Hi friends, today I'll be discussing about the FIGO staging of endometrial cancer. As you could see, I have put up the FIGO 2009 staging here. This FIGO 2009 staging has taken into consideration just the anatomical spread of the tumor. So it was just made very simple based on just the anatomical spread. But the FIGO 2023 staging has taken into consideration several other important parameters with respect to the tumor. That is not just the anatomical spread of the tumor, but even the histology, the molecular classification, as well as the LVSI, that is lymphovascular space invasion. All these three additions have been made into a 2023 staging, and it's very important to know this. So the basic staging remains the same. That is stage 1, it is the tumor is limited to the uterus. Stage 2, it involves the cervical stroma and glands. Stage 3 is the pelvic spread, that's beyond the cervix. Stage 4 is the metastasis. So anyone is a mnemonic lover can remember like UCPM, the major staging. That's stage 1, 2, 3 and 4. Okay. Now let's go to the major important aspect, that's stage 1. So as we already discussed, it's confined to the uterus. So stage 1A is like a tumor is invading less than 50% of limited to the endometrium or less than 50% of myometrium. 1C means more than 50% of myometrium. 1C is the aggressive histological variants have been put up here. So 1C as a whole is a very important thing. It's not been there. It's not there in 2009 FIGO staging. So it's important to know this. 1C is aggressive histology but still confined to the uterus. So I highlight the important new additions in yellow. Yeah. So you could see that stage 1 is 1A, we have just discussed 1A, 1B, 1C. Now 1A has further subclassifications. Before that, let's go to the picture. So 1A, it is limited to the endometrium with occupying less than 50% of the myometrium. This is this is like more than 50% of the myometrium, and stage 1C is the aggressive histological variants. Okay. So here how you can see how histology has come into play in 2023 classification. Now if you want, it's good to know the further subclassifications of stage 1A3, 1A. So that is 1A1, that is limited to as an endometrial polyp and confined to the uterus. 1A2 is less than 50% of the myometrial invasion. Thus, there could be LVSI, that could be, or no LVSI. No LVSI, or there could be focal LVSI. LVSI stands for lymphovascular space invasion. 1A3 is endometrial cancer with ovary involvement. This is an important thing. Again, I'm highlighting this with yellow because this is a bit confusing as well. With ovary involvement, but there's no without peritoneal spread. Very important to know. This has no peritoneal spread. Okay, keep that in mind. There's no serous or peritoneum involved here. So that's why if they tell ovary involvement without peritoneal spread, please put in 1A3. Earlier, if ovary was ever taken into consideration, it would have been directly put in stage 3A. Right, but now you should remember that if ovaries without peritoneal involvement is put in 1A3. Okay, I hope I have made myself very clear about this. Okay, so coming to stage 2, we have stage 2 is all about cervical stromal invasion. Okay, sorry, stage 2 is all about cervical stromal invasion. So we have tumor invades the cervical stroma here. That is 2A, cervical stroma. 2B has substantial LVSI. Okay, that's high risk of recurrence is there in LVSI with substantial LVSI tumor. This is 2C, aggressive histology with any myometrial involvement. Okay, here with myometry, aggressive histology plus myometrial involvement is put in 2C, not in 1C. 1C is just aggressive histology but confined to the uterus and involving just the endometrium only. But if there's a myometrial component and aggressive histology, it's put in 2C. I hope this point is very clear. This whole 2A, 2B, this all thing, everything is a new addition into a 2023 classification. Earlier it was just stage 2 in 2009. So keep that in mind. So again, you can see how histology is incorporated in the staging. Okay, if there's an aggressive histology, all before this, these are all low-grade histological variants. Okay, this aggressive histology will come as 2C. So just going with the picture, you could see that 2A involves just the cervical stroma and glands. 2B with substantial LVS. There's a high risk of recurrence. That's why substantial LVS. That's lymphovascular stromal space invasion. Stage 2C is aggressive histological ties with myometrial involvement. Okay, you could see right how myometrium is also involved in this. Yes. So this is stage 2. So I hope stage 2 classification is made clear. In 2009, there was no subclassification. So it's important to know this, ABC. In 2023, it has been added. So now stage 3 is like beyond the uterus, just involving the pelvic spread. Regional spread is nothing but pelvic spread, okay? So yeah, if 3A is tumor involves the serosa, peritoneal involvement with or without adnexal involvement, okay? So serosa is the key to this, okay? So 3A1 will be what? Just ovary or fallopian tubes with peritoneal spread. 3A2 is uterine serosa, subserosa. So 3A is all about the peritoneal involvement, that is tumor invades serosa. Then coming to 3B, that is the other things within the other organs within the pelvis, like vagina, parametrium or pelvic peritoneum. So vagina parametrium means it is 3B1, B2 is pelvic peritoneum is involved, okay? Everything is new, like this further classification, 3B, 3. So this is pelvic peritoneum involvement, okay? So vagina parameter of pelvic peritoneum is 3B. 3C is lymph node. This is the same. C1 is pelvic lymph node involvement. 3C2 is para-aortic. But earlier it was just pelvic and para-aortic put in 3C. But now they have just divided this further. C1 is just pelvic lymph node metastasis. The 3C2 is para-aortic group of lymph nodes. Further you could classify by putting a small one like this. Like this, you can write one and then show micromets and macromets how they are further classified, okay? If you want, you can write this further classification, not required though. So yeah, so I think these points are all clear, right? How it is. So 3A is just serosa with or without adnexa. 3A1 is ovary or fallopian tube with peritoneal spread, and without peritoneal spread was put ovary involvement was put in this one 1A3, right? So yeah. So I think all the points are clear. Serosa, then 3B is involving vagina, parametrium, pelvic peritoneum, 3C is lymph node involvement. Coming to metastatic disease, that is stage 4. Okay, before that the picture, I'll just correlate with the picture if you want. So you could see here, 3A involves just the adnexal mass along with the serosa. Adnexal mass, it goes, the tumor involves the adnexa along with the serosa, 3A. 3B involves what? Okay, 3B is all about the vagina parametrial involvement. Yes, vagina parametrial involvement, okay? 3C, you can have C1 is pelvic lymph node involvement, C2 is para-aortic group of lymph nodes, okay? So this one classification gives it beautifully, okay? Now coming to stage 4, we have stage 4A is bladder, and earlier it was just 4A and 4B. Now 4C is a new entity that's added here. And this 4B with abdominal peritoneal mets is also a new thing altogether, okay? So stage 4 metastatic disease, 4A is bowel and bladder mucosal involvement tumor involving. 4B is abdominal peritoneal metastasis beyond the pelvic peritoneum. 4C is distant metastasis, okay? So this is the new FIGO 2023 classification. You can take a snapshot here. Yeah. So just going with the picture, you could see 4A involves just this is the bladder involvement, or even it could involve the bowel, that's the colon here. So 4A is bowel and bladder mucosa involvement. 4B involving abdominal peritoneum. If the tumor spreads into the abdominal peritoneum, it is considered stage 4B. And stage 4C, you could see here, it involves beyond the abdomen, other organs like lungs, heart, brain, bones, all that is stage 4C, distant mets, okay? From it goes completely above, like liver, all that, if it involves. So you can take a snapshot here also for better correlation with the picture if you want. Yeah. So now coming to the molecular subtypes, okay, that's also an important aspect, as I've told. How have they incorporated into this 2023 staging? So basically we have 4 important molecular subtypes in endometrial cancer, okay? That's Pol gene mutation, POLE, or mismatch repair, P53 gene mutation, as well as no specific molecular profile, that NSMP. So anything associated with POLE mutated, that's Pol mutation, is DNA polymerase epsilon gene mutation, okay? This is a low-grade endometrial and ultra-high mutation rate. But clinical significance is what is important as a clinician. Why this whole molecular subtype is like a genetic fingerprint of the tumor, okay? Based on which I will decide how I should go with the treatment, how I should go with the prognosis. So you could see Pol gene mutation have a very good best prognosis and may not need chemotherapy. No need of chemo in case of tumors with Pol gene mutation. Okay. Now coming to mismatch repair. It's associated with genes such as MLH1, MSH2, MSH6. All these are commonly seen in Lynch syndrome also. This have intermediate prognosis and can respond well to this immune checkpoint inhibitors like pembrolizumab. This you can mention. So this is mismatch repair deficient. Okay. If there's a defect in P53 abnormality, so that is P53ABA that will be shown, P53 abnormality. So this is a very worse prognosis, high recurrence rate, and this requires both aggressive management as well. So you should give chemotherapy and radiation. There was no chemo requirement in Pol gene mutation, but in P53 you need chemotherapy and radiation. So I hope you're able to understand how to correlate this clinically. And if there's no specific molecular profile, like we can't identify it as a pole or MMRD or as P53, you have to consider this as no NSMP. So these are usually low grade endometrial tumors, and they have intermediate prognosis managed based on the tumor grade and staging. Okay. So how do you label this? Okay. So suppose if it is given as 1A1 small letter m followed by pole mutation, so I can understand this as stage 1A with pole mutation. Similarly, 2C small letter m P53 abnormality, stage 2C with P53 mutation. So I hope I have made myself very clear. You can take a snapshot here as well. Yeah. So I have made myself very clear with respect to the 2023 FIGO staging as well as the molecular classification involved and its clinical correlation. Thank you. You could refer to my playlist for FIGO staging of other gynecological cancers. Thank you.